Recording in progress.
Hey everyone, and welcome to BNS Meets World. I'm your host, Stephanie, and I'm a social worker dedicated to understanding the whole person. Have you ever wondered why you might react to stress differently than your friend, or why therapy might not be enough if you're struggling with housing or finances? That's what we're here to figure out. Mental health isn't just one thing, it's a powerful, intricate dance between the biological and the social, the B and the S that shapes your world. Today, we're diving deep into the biopsychosocial model. We're going to explore those microscopic neurotransmitters and brain structures that influence your mood, and then we'll zoom out to look at the big picture factors like poverty and social support. And because we're all about solutions here, I'll walk you through a powerful mind-body treatment approach that heals both your brain and your stress levels at the same time. Let's get into it. When we talk about mental health, we must start with the biology, the hardware, so to speak. I want to describe two key biological determinants that significantly influence a client's mental health. First, we have genetics, which refers to inheriting certain genes that make an individual more vulnerable to developing a particular mental health disorder like schizophrenia or major depression. It is not a guarantee, but it could happen. If mom or dad has a history of major depression or schizophrenia, anxiety, it could go back to grandma and grandpa, then it is not a guarantee that you can get it, but again, it could happen. Genetic variations can impact how genes are turned on and off throughout life, contributing to onset of some disorders, though most common mental disorders are the result of a combination of life experiences, environment, and genetics. If a client has a strong family history of depression, they may be more reactive to stress and environmental triggers, potentially leading to an earlier onset or more severe course of the disorder. People do not inherit the illness itself, but they inherit genes that make them susceptible. Secondly, you have conditions like chronic pain, diabetes, or heart disease, which are physical, but their effect on mental health is profound. The constant stress, inflammation, and reduced quality of life associated with these conditions take a massive toll. When you are constantly under stress, constantly just going through stress in your life, it triggers pain, which can turn into things like fibromyalgia. Fibromyalgia is a great example of chronic stress in someone's life because it is due from overactive nerves in the body. Clients dealing with chronic illness often experience higher rates of anxiety and depression. The physical stress of the illness can alter brain chemistry and deplete emotional resources, making it harder to cope with daily life. Now, let's shift the social determinants, the environmental factors, context, and community a client lives in. These are often the areas social workers can most directly address. The WHO Commission on Social Determinants of Health argues that conditions in which people are born, grow, live, work, and their age are largely shaped by the distribution of power, money, and resources, which leads to avoidable health inequalities. If you grow up in a low-income area, if you have parents who have grown up in low-income areas and it just kind of is generational, then there might not be great work. You didn't grow up in that type of environment. So that is what the WHO is talking about when they are talking about avoidable health inequalities. We have things like socioeconomic status. This includes income level, education, and occupation. Poverty is a persistent, systematic stressor that can affect everything from nutrition to housing stability to access to care. In fact, individuals' mental health and well-being are dependent on social factors, including housing, employment, education, and adequate nutrition. If I grow up in a low-income area where my mom and dad are struggling to maintain paying the bills, putting food on the table, I'm going to feel the stress. My mom and dad are already feeling the stress, and then this just turns into that systemic stressor because those things are essential basic needs. A client struggling with poverty faces chronic stress over basic needs. This prolonged stress elevates cortisol levels, which can damage brain structures over time. Individuals from lower socioeconomic backgrounds are more likely to experience mental health disorders like anxiety and depression due to the stressors of financial insecurity and poor living conditions. A finding echoed in college student populations where financial strain is negatively related to mental health and higher family income is positively related to mental health. Next, we have social isolation and lack of support, which is the absence of a meaningful social network, no trusted friends, family, or community ties. High-quality social connections are essential to well-being. Social isolation is a powerful risk factor for mental decline. It can lead to profound loneliness, which is linked to increased rates of depression and anxiety. With this, we get a combined effect of financial strain, housing stability, and food insecurity, which often accompany isolation, show roles in affecting mental health, underscoring the necessity of discovering the interlinked and increasing impact of these social determinants. Sometimes when you are isolating yourself, it can be things because you have friends that didn't grow up like you. You're embarrassed because you grew up poor and your friends maybe grew up middle class or even richer than middle class. So all of that stuff has effects on depression, anxiety, and just isolation in general. So that way you feel like you need to isolate yourself because of the guilt, the embarrassment of the low socioeconomic impact that it's had on your life. A client with strong social support, however, has a built-in buffer against life stressors. And again, if I come from a background from a middle-class family, yes, not everybody's perfect. I might have depression and anxiety in my life, but because I am not in a constant world of fight or flight, or I don't know where my next meal is coming from, because I have great emotional support. I didn't grow up in that kind of environment. I have a better chance of getting help for my depression and my anxiety. Tying the biological and social together requires a quick look at the brain, the mediator of our experience, which we are going to discuss and talk about two critical players in this. The amygdala, which is also called the brain's alarm system, plays a key role in processing emotions, particularly fear, and triggering the fight or flight response. Influence on mental health disorders such as anxiety and PTSD, the amygdala can become hyperactive, essentially getting stuck on the on position and causing the client to perceive neutral situations as dangerous. Chronic stress from social determinants, such as poverty or discrimination, affects nerve activity and the synaptic plasticity within the amygdala, highlighting its pivotal role in stress responses. If I come from a background that is constant high stress, constant negativity, fighting because of the way that we're brought up, I have a better chance of experiencing the fight or flight situation, no matter if it's something minor. Serotonin is a chemical messenger involved in regulating mood, sleep, appetite, and social behavior. It's often called the body's natural feel-good chemical. The influence on the mental health can lower levels or have poor functioning of serotonin, which are associated with major depressive disorder, or known as MDD. Many antidepressant medications, such as selective serotonin reuptake inhibitors, or SSRIs, work by blocking the reuptake of serotonin, making more of the neurotransmitter available to help improve mood and emotional stability. So, how do we as social workers pull all of this together? As a social worker, I must approach treatment holistically. The approach I recommend is mindfulness-based cognitive therapy, or in short, MBCT. Now, you ask yourself, what is MBCT? It is a group-based psychosocial intervention primarily used for preventing relapses in clients who have experienced recurrent depression. It integrates two powerful modalities, which are cognitive behavioral therapy, also known as CBT, and this is the psychosocial aspect, which clients identify and challenge negative thought processes, patterns, and behaviors. Second, we have mindfulness meditation, the biological mind-body aspect, which trains the client's attention and helps them observe thoughts and physical sensations without judgment. How is this integrated into biological and the psychosocial aspects? Well, biological mind-body interventions, such as mindfulness practice, is a biological intervention that studies on mindfulness-based stress reduction, also known as MBSR, and MBCT show that these practices leads to decreased functional activity in the amygdala, which is our alarm center, and increased functional cognitivity with the prefrontal cortex, the area responsible to self-regulation and emotional control. This physically helps the client calm their nerve system and to exit the fight or flight stress response. Also, another great one is EMDR therapy, which the client, sit with the therapist and you go back and forth with a light, and the therapist asks very, very specific questions regarding that trauma, what's causing the PTSD, what's causing that anxiety and the depression, to try to help that fight or flight situation. And it essentially rewires your brain, not allowing it, well, you don't forget about the trauma, but it just helps you to understand the trauma and to realize that you can come out of this, you can be a survivor, so that way you don't have to live in that victim mentality your whole life, which is extremely detrimental to your well-being. This equips social workers as myself, and it equips the clients with the skills to address things like social isolation or work stress by restricting how they react to certain challenges. Understanding the interconnectedness of genetics, environment, brain chemistry, and social factors isn't just academic. It's essential for optimal effectiveness in social work practice. Now, if we only focus on the biological, things like medication, we'll miss addressing the crippling stress of poverty or discrimination. If we only focus on things such as the psychosocial aspect, we can miss out on clients' underlying genetic predisposition or a physical health issue driving their anxiety. A holistic, integrated perspective like the one embedded in MBCT allows us to develop truly person-centered interventions that address the client's internal state and their external world. That's how we help people not just manage, but truly, truly heal. Thank you for tuning in. I am your host, Stephanie. Until next time, remember to be kind to your mind, your body, and the world you live in.